Welcome to We Think, We Talk, sponsored by Select Care Pharmacy, a pharmacy that is non-retail but that services the smallest of group homes to the largest of skilled nursing facilities, with prompt attention and care and world-class customer service.
Welcome back to another episode of We Think, We Talk. I'm your host, Andy Garrison, sponsored by Select Care Pharmacy, a non-retail pharmacy that services, obviously, a lot of you guys that watch us, facilities, long-term care communities, group homes. What I wanted to do today was take the opportunity to sort of go through some questions that I've had. Of course, we have guests a lot of times it's me. Today, I just wanted to be a little educational because I wanted to work both sides of the table. I think it's really important for us to understand the perspective of the new client coming into a community and what makes that work. Right now, this is a very important episode, I feel, because I know it's budget time for you. So as you're going through your budget, you're looking at every component. I've done it with you for a long time, so I understand how stressful it is. And I also understand the fear that you guys have because a part of the budget that you overlook is the pharmacy. You look at our long-term caregivers and med techs that pass the medication, give the medication, but usually you're settled in your pharmacy and you really don't want to look at contracts. So I'm also going to advise you today, since we're sitting in November, keep your pharmacy in mind. We are a local independent pharmacy, which is very important because there are large pharmacies, and those large pharmacies can't necessarily give you the customer service that we can on a smaller level, but obviously world-class customer service with world-class equipment, packaging, everything that you would expect. But looking at long-term health care in general, why do we look at the pharmacy? Why do the families look at the long-term health care as that being important? A lot of times you have to understand the decision-making process that our families are going through right now, coming to our communities. They're meeting with many marketers. And a lot of the questions that I've received at meet and greets and coffee meetings and late afternoon lunches with executive directors, long-term care providers, you regional managers, and family members. Why does all of that matter? Well, obviously there's a time and a place to start to consider long-term health care. And you as the caregiver, you could be the child, relative, aunt, uncle, you start to notice things and you start to have these conversations. And these conversations become very, very important. Not only are you the closest caregiver to your family member or the person that you're looking at long-term care placement for, you know their likes, their wants, their dislikes, but also you know some of the problems that they've had to get to this point. One fun fact that as I was driving here this morning, I thought about was the simple fact of myself and just aging. Aging in general, you get aches and pains. I know a lot of you guys do on areas that we never even thought of. I didn't even know it was a muscle. And now apparently it's got 4 of them and they're all sprung at one time. We carry on, but cognitively we've come to a place that we know it's very important for our loved one to be taken care of. But what exactly is a trigger factor to let you start swaying your mind as the power of attorney or the decision maker or the caregiver of this person to say, this is maybe a little more than they can handle. And then you also have to say, what can I handle? First and foremost, let's talk about the finances. A lot of times families come up to me and say, mom and dad, whoever it may be, they're having a spending habit issue on different things that don't quite make sense. Could be sending money to organizations they never have sent money to, buying objects, hiding those objects and repurchasing them, not remembering where they put things at. A simple story I can give you is there was a family member that had approached me, and this is a couple of years ago, and their realization moment, which seems silly because their family member did not seem to have any clear signs or symptoms of dementia at the time. But when the family was visiting, went out to a backyard shed, a garage, I'm thinking it's probably like a little utility hut, and opened it up, and it had thousands of rolls of toilet paper in there. But yet he had just got done talking with a family member 30 minutes later, and the family member said, if y'all got to go to the bathroom, you need to go buy some toilet paper. We're out. So for some reason, that was a trigger in this person's mind. And so he was buying, storing it, forgetting he was storing it back there. So that brought questions up. And then, of course, families start digging and digging into it more. Well, what happens when they start digging is where they start to realize one thing that I like to share and talk about, being that I am with Select Care Pharmacy. They start looking at their medication. And a variety of things happen with medication. One, medication is maybe prescribed wrong at the point. They haven't been to the doctor in a long time. They're simply taking what they've been taking for years, and they need a checkup. A simple go to the physician, have the blood draw, have all the complete workup done, everything that they need, and some of those medicines may need to be changed because they could be affecting them in a different manner than anticipated. The second most common thing that we end up seeing as families start digging when they see a need for further help outside is on the medication side, that medicine's just simply not being taken. Hadn't been taken in days, in some cases weeks, I've seen months. The family member really thinks they're doing their normal morning routine, but they are omitting their medications. Not necessarily on purpose. It could be because of cognitive disease. It could be another plethora of things. And then obviously there's the one that family members notice with medication. It's a two-part. Either they're taking more than prescribed and running out early. Obviously, taking more medication than is prescribed at one time can change altered mental status, make you do things that you normally wouldn't do. Or in some cases, the second question that's always loaded in, mom and dad taking too much medication, you forgot they took the pill this morning, so they take it this afternoon, is also running out early. And then you run into a problem running out early, pharmacy can't fill it early, so therefore now you're going days without medication, and which is equally it can be problematic as taking too much medication. It all depends on the medicine. It all depends on their habits, morning, afternoon, night. So you start to see this, and you, as a caregiver, as a power of attorney, you start to take on roles. Maybe I'm gonna start calling mom or dad. Hey, did you take your medicine this morning? Little subtle reminders to see what's going on, and if you don't live with them, and you start taking more trips to visit them. Because one thing that we've noticed, and we have spoke of 1,000 times in our field, is when we're on the telephone with our loved ones, they can fool us and trick us real well and let us think everything is okay. But until you see it in person, it can shock you and surprise you. So the fear factor comes in. We at the pharmacy, we have a clear understanding of why the loved one is placed into a community. You've had to go through a lot of steps as the power of attorney to get this person in the community. Most of it obviously boils down to medication, nutrition, and grooming, ADLs, basic life events that you have to become aware of. We understand that, so we can sit down with the family with you to help ensure that your care plan is proper. The reality that's happening in our industry right now is our industry has aged. From when we first started what we called assisted living and memory care, and I can remember this until now, we've got really good at what we do. And I'm so very proud of many communities around here that are super strong. And I'm so very proud of the advocates and leaders that we have for our aging adults that really do consider their needs, their wants, their dignity, all of those items that are very important to us right now. We're carrying that on. As a lot of you guys know, it's American Heart Association time. We're working to raise money for that. That's another important piece of the puzzle. We're always trying to help each other out in the medical field, whether it be dementia, heart association, Parkinson's. It all becomes one big cloud that everybody needs help. But we at the pharmacy, it's very important that we simply can come in, take a look at what medications were prescribed years ago, where are they at now, look at behaviors and patterns, work with your care staff, your med techs that we train. We personally come in, give the training that we need over and over. I do it a lot myself. Most of it I do. And I want to make sure that they have a full understanding of when, where, what, all the routes. Just that move by itself in getting on the right medications a lot of times shows a great cognitive change back to a balance that's acceptable. But like I was saying before, we as caregivers of the family, we start doing these reminder calls before we ever make it to assisted living to make sure they're taking their medicine, to make sure they're doing what, and that's building up stress on us and worry. And we try to figure subtle ways to help our family members remember to do these things without making them upset at us. And to be honest with you, you don't want someone upset at you because you love this person. You're trying to help. But it does come to this point, you have to make a decision about a whole community. Many communities in South Carolina, North Carolina, Eastern Tennessee, and across the United States are really, really good, but each client's needs are different. Each client's needs financially are different. All those things go into a big pull factor, but I can assure you, whether it be a very, very expensive community or a community that is not as expensive, you can find a great pharmacy program within that community. That's where we step in, because each and every client in a community, a long-term healthcare community, whether it be memory care, assisted living, group home, they have a care plan created, and we become a part of that care plan. We're in touch with the physicians, obviously, every 3-6 months, in some cases a year, depending on what it is, to see if the medications are still proper, see if the medications are correct. One big thing that happens, since we know that a lot of time placement is driven by medication habits gone wrong, cooking habits gone wrong, hygiene, daily living, getting dressed, washing clothes. So all those things pile up, but a lot of it always stems back to the medication portion of it. Is we like to, educate the family, of course, educate the facility, the community, but we're in control of the orders that come from the physician. Let's say a physician chooses not to refill something. We can call the physician, request a new order for a prescription, and maybe get detail of why or why not. We also work directly with many of your communities that have physicians, nurse practitioners that come within the community to see your family or your residents and the loved one family members inside where they live. We can have those conversations about medications they prescribe or they discontinue simply due to the fact that it's pharmacy to physician or pharmacy to provider. And in some cases, the provider, the doctor, or nurse practitioner may write a prescription that unfortunately is not covered by the client's insurance and is too very expensive for them to afford. We like to be that little part of us being an independently owned pharmacy where we can go in and say, let's call the physician, see if there's another medication that's more affordable to help this client. Because if the client can't afford the medication and afford the placement, you have to look and see, where are they being helped? Is it, are we harming them more? Are we helping them more? Is it all a financial problem? No. Retail pharmacies are great. I have to use a retail pharmacy just like everybody else. And we all know the big box stores, the name brands. But they're putting out thousands and thousands of prescriptions a day. And to be quite honest with you, many of those pharmacists are my friends and I know them. But to have that sidebar conversation that you used to could have with a pharmacist by asking them questions, just look around. They're just too busy. The drive-through is packed. Waiting on the inside, everybody waiting for their name to be called for medication. So to have that personal component is very important, especially as you age. I know at Select Care Pharmacy, I receive telephone calls from family members from different communities just in question in regards to billing or future costs of certain things because they know that I'll respond to that. Even though we service large communities, we still want to be that personal connection because what happens when the client, which is your family member, you choose to place them, and now medication is being refused. Medications aren't accepted by this person because it's different. We're your partner in this. We would also like to work with the physician to see if there's something that we can change, omit, whatever it may be, to make it where they're more likely to take their medication and help them. And we have some tips for you as well. The community itself, medication management is very important. Your food service is extremely important. Obviously, your janitorial housekeeping. So every component you have within your community is so very important because you have to remember where the client came from. They came from home. They are and were you just several years prior. So did they want all this change? Did they want this to happen? Did they even cognitively realize what's going on? You know, you have to ask yourself those questions and what's safe for them. You have to do what you can to keep them safe. The best thing that we love to see from a pharmacy is after we come in and their medications get regulated, we've talked with the physician, we transferred everything over, which we need to talk about that, by the way, because a lot of communities are scared to transfer from their current pharmacy to Select Care or other small pharmacies like ourselves, independently owned. They think it's a lot involved. Give me a call. It is a very simple transfer, but the customer service that you'll receive will far outweigh the effort it takes to switch pharmacies. And your customer service level will increase so much that really I have phone calls where people can't believe what the program has done for their business. We like to get in there and help. We like to help create new family nights to educate on protocols and the way we do things. But as I was speaking earlier, we're working with the physicians and providers for your loved ones within the community to ensure that the medications are being given properly, the right dosage, they're not expired. Your team that works with the community that are dispensing the medications, they also can have a sigh of relief working directly with us for the simple fact that, oh my goodness, they look and Mr. Smith only has one of these tablets left. Instead of having to run to a retail pharmacy to get the medication, simply pick up the telephone, you call, we answer, you will speak to one of us, and that medication will get there. Because one thing that led them to the community was them not taking the medication, so we don't want to have a repeat of that. So a small pharmacy that's independently owned can give your staff the personalization when medication issues arise, because they do. You figure if you have a property that you operate or run, or you're thinking about putting your loved ones in a property, there could be 100 to 150 clients within that property that live there. So there's a lot of medications that are being passed that come and go. We still like to be able to give you the time where you feel like that your loved one is the only client we have. And that's also what we like to project, because we want to do our very, very best to ensure that it goes smoothly. Everything from the intake process, the reviewing the medications with the provider, the physician, even your billing. Your billing is a big thing because a really new clients looking into assisted living or memory care, they don't necessarily realize that we at Select Care are partnered with the community. We don't have a stake in the community. We don't own the community. We provide the medications and deliver them. But yet at the same time, we want to work directly with the community to be their partner, so we know as much as they do in regards to it. So their staff that takes care of mom, dad, aunt, uncle, they feel free to call us and have a honest, open conversation with what's going on with the client and what they need. And we, as a small pharmacy team, we will actually huddle up, and it could be with 50 patients in a day that we need to talk about, but find the best track, the best pharmaceutical program for them to ensure that they have a good quality of life within the community that they live. But back to you as the caregiver, the primary POA, you start feeling the pressure when you start to notice these medications can't be managed. And a question that was brought to me before, or more of a statement, I should say, that really did make me think was a family member that had been doing a really, really good job taking care of their loved one. But what they noticed is they were having to go to the pharmacy every couple of days because the medications weren't lined up, like all the prescriptions hadn't been wrote on the same day. Over the years, medications had been added or deleted. Many different physicians had added or deleted, had came into their world and weren't in their world anymore. So it was a big confusion, very difficult thing to navigate and time-consuming. One good part about having a non-retail pharmacy that I believe makes a huge difference within your community, right away, you notice that almost immediately when that first week, is what we call a cycle fill. There's medications that your loved one, they're going to be on every day for the next ever how many years or until the physician changes it. That's the same. Well, you may have 6 or 7 of those medications that they'll always be on, they have to take every day. The new order of medications will come into the community. The community will place them properly in the med cart that we provide. Before it runs out again, you get the same medicine coming back. All your dates line back up. So you don't have to worry about missing something. Did I forget a medication? Am I going out of town and who's going to pick up the medication? We bring them in totes, obviously by couriers from the pharmacy themselves. So we can keep track to ensure that medications are available that are prescribed for your loved one and your client. And it also brings a sense of ease to the community because a lot of you don't realize that have not been within the system of assisted living memory care, that the communities are regulated by DHEC. In DHEC, which is Department of Health Environmental Control, if a medication was supposed to be given, it has to be documented that it was given. If there's a prescription, the medication has to be on the cart. We realize these things, and the community themselves can be cited if the rules aren't followed. So we act as a partner also to ensure an audit to make sure that all that information is there, the medications are on file properly, to help the community stay above good. We want them to be great or excellent. But it all comes back to the client, and it all comes back to the decision maker about who's putting the client into the community. Once again, don't focus so much on price and beauty. If you listen and go back and watch our past episodes, it's not always about the paint on the wall. It's about the integrity and the reputation of the people that are within that community that work within that community, because they're obviously, this time of year, there are a lot of jobs available. You see signs everywhere that you go. People literally could be choosing to do something else, but they have given their heart as a servant to caregive for other people, which is a very tough job, and we know this. We want to be the factor that can come in and help create a program to make it easier and safer for you in your community, and help where we can, because we also are compassionate about it as well. We spend a lot of money getting information out to the public about different things that have nothing to do with pharmacy, but has overall benefits for success and the greatness of daily living that we can give clients doing something else, whether it be activities, whether it be new information with knowledge, classes for staff to teach them about new upcoming methods of medications and how to be given properly and what to do. In some cases, it's a matter of talking to the residents. Sometimes they're so used to taking a pill that's the same color, and the manufacturer changes the color, or we go to a different manufacturer of the medication. We want to come in and tell them about it, so they're not scared to have that relationship with our pharmacy back and forth. So we don't look at the paint. We look at the people within inside of the community, and we'll create a program that's just as strong, whether it's that community where that person is paying $10,000 a month to live there, or that person is paying a few $100s. I know that probably doesn't exist, but I'm just giving you the range. You're going to get a world-class program that we can ensure, because we know that, as I said just a moment ago, 75% of the decision of moving to a long-term skilled care nursing home, boarding home, was probably medication driven in some place or another. We want to be your partner with that. We have the resources, we have the staff, we have the education, and also we value what you know. You give us tips, hints. We like for it to look in the community's eyes as everything flows as one. Like I said before, we don't own the facility, but many clients think or don't realize that we don't. They think that we're all one, and that's a compliment because we all can work together. But speaking specifically to the executive directors out there now, it is your budget time, and you're going through and you're looking at every number from the community, all the numbers. I know what you're going through. Please take a moment and think about your pharmacy and what locally, independently owned pharmacy like Select Care can bring value, what we can do to help you in your community, and even take some off that budget by doing trainings and other things that you'd have to allot time for, as we call FTEs. We can help you with that to make it more cost effective for the community, as well as a great quality of life for the resident and great customer service for all the family members. So please take time, give us a call. We certainly want to help you. But it's like I say, if you don't know, you don't know. 5 minutes on the telephone with me, I'm not going to try to get, this hardcore salesman pitch at you. I'm simply want to go over your current plan and give you experiences of previous clients that we've helped and how we've changed, things that I've learned as an executive director over the years that could also implement in your community that would make a big change. So we certainly can work as partners together and help each other. So guys, I hope that this information you'll take and think about. Family members that are looking for communities, remember, ask about the pharmacy program, how it works, who do they use, can the medicines get to them before you ever start worrying about the paint or exactly the location or any of that, because that's a huge part of the care plan that will be given to your loved one. And we want to be a part of that care plan so we can help you ensure that you as a family, we as a pharmacy, you at the community level are doing everything that we can do to give world-class customer service. But until next episode of We Think We Talk, God bless.